I don't normally seek out clinical trial information unless it's something that, for example, when my sister was pregnant, there were things that I would research on because of the things she would say, like, oh, everybody has to get this vaccine. Then I would go and say, okay, why? And so I would read on it, and then through the research, I would find out about different clinical trials for different things. But normally it has to do with timing, and it usually is related to something I'm either going through or that the person that is treating my kids or myself knows about, and he or she happened to let me know whenever we are being taken care of at their practice. So,
to be honest, the only time I find out about clinical trials, or used to, I don't ever hear of any so much anymore. And that was the only time I did was when I was running a medical practice in North Oakland. And that was only because the provider I was working for, he was getting different grant monies to do clinical trials. So, and that was only, so it was only because I actually was in the environment. But it's not something that I see, even just going to regular doctor's appointments with anything like acknowledging there's clinical trials, or if you're interested in. Every blue moon you might see something on TV, but it's a clinical trial that on something I have no clue what it's about. So on a norm, I can honestly say that I don't hear about clinical trials. And I don't know anyone that actually does hear about them. So it's not something that's just public knowledge.
I don't know. That's a tough one. The trust factor set in so much where, I just, it's hard to trust clinical trials. You don't know what if something goes wrong, or, they'll say, well, it worked on 90% of the patients. Well, what if I'm the other 10%? And well, I developed other things because of the trial. But as far as like medications and things like that, that's a tough one. I'd have to be convinced and talked to by someone that I trust.
I don't know that I would, unless the trial was for something that I consider to be extremely safe and non-invasive for my body. And the reason why that's the answer is I see the value in clinical trials, but I also know that the way they've been promoted in the past, for me, it's very alarming. It's a bit sketchy. I think that the way that it's promoted is not very welcoming of people that are more educated about the side effects of drugs now, the side effects of treatments, the side effects of even food in your body. And I happen to be very versed on that. So, and if I were to be in a clinical trial for a procedure that is non-invasive to my body, that like sound waves or things like that seem a little bit less invasive than having chemicals running through my bloodstream, then I would probably more likely to participate in that.
Sure, I would, especially if it's something that that could help someone else. Here's the fear, though, and I think, and I don't speak for everybody, I'm just speaking for me. The fear of clinical trials is when you look back in history of clinical trials, when they weren't called clinical trials. Let's say the whole thing with the syphilis. The fear is, am I a guinea pig? And what are the results? Do I really find out the results? If I have it, are you going to really tell me? I know that's old and the laws and times have changed, but it's still a fear factor. And it's a fear factor of the unknown. And I guess it depends on the kind of clinical trials too. Where if it's something that, where it's a weight loss thing, where you're seeing if you eat this and this team over here eats that and see who loses weight, that's different. But when it's something that comes about with implementing any kind of medicine regimens, then it becomes concerned, because then you're not quite sure. It's a fear. I mean, not saying that it is, but it is a fear. What are you really giving me?
I just don't feel like the clinical trial companies have any rapport built with the market whatsoever. with the regular consumer whatsoever. I can tell you that I have, my physician, I've rotated physicians because they're quick to prescribe things that are, they have excessive effects for the severity of what I'm feeling at any given point in time. There's no phase to the process. There's no familiarity built. Phase of medications is pretty tainted. I don't know that medical trials or the industry of developing new medicine has done a good job about connecting with people. Even though they may be saving tons of people, and in the long run, I believe they do. I think the misconception that we have is that we're lab rats to them.
Think about every time someone sees these clinical trial commercials, they automatically write it off. You automatically have a judgment about it. Mm-hmm. You automatically wait to hear, and it's kind of a joke as well, but you automatically wait to hear what are the side effects. We want to clear this up. Okay, I'm waiting on the end of the commercial to hear the insane amount of side effects and how crazy they are. The only way I can probably begin to trust would either be through word of mouth or someone that I trust, and probably word of mouth through someone that I trust. So whether it's a physician or someone that I know directly that have gone through the trials or going through the trials or knows the company directly, the gap needs to close to where it could be more relatable, it could be more humanizing.
One, it would be great. You would think as medical providers that you see routinely for your physicals and what have you, you would think they were more abreast on the things that's out there available for you. That patient would say that illness or family member that has that illness, that are making them aware of alternatives and things to find out about what's going on with it and how we can go beyond treating it and go to fixing it, and not putting a Band-Aid on it. So I think starting with your primary care physician would be a good. You would think it would be a good place to start. Because then when I see it on TV, and say you see a commercial that you may see once every blue moon about some study or something, 9 times out of 10, I'm not going to trust it. But you may trust it a little more if it is coming from your medical provider that you hopefully have some trust in, that takes care of you health wise. So for me, I would prefer that it came from either a medical provider or something in that realm of medicine, and not so much just some corporation dropping out emails or random text messages or billboards or that type of advertisement. I think it needs to come from a place where the persons are trusting the information they're getting. Social media at this stage in life is always going to be a great avenue for this, because the bulk of America is on some form of, or not America, but the country, the world as a whole, is on some form of social media. So people don't talk on a phone anymore or mail letters. Everybody's on some social media. So I would believe that would be probably the best avenue starting out.
I would absolutely love to receive information. Now, I take my hope out of the physician. So if I actively want to receive information about, let's say, anxiety in high school children, because it's something that I see that it's a problem and it's increasing and it's prevalent and I have here in my house, I would absolutely go online, and I'd like to request the information be sent. Studies. I'd like to read the studies. I'd like to read success stories clearly. I would also like to be aware of any side effects. I'd like to receive just honest case studies about the patients, not just like, here is, Jane Dane, 17, feeling great after taking, 3 rounds of this, and look at her skin and her hair. And it's not like a marketing pamphlet. Like someone to write the progression of how she started, what she went through, and how the improvement was felt, so that I can see a real human being looked at another real human being going through the trials. That gives you a sneak peek into a world of people that we think put glasses on, put a white robe, go in a lab, and then look for subjects. If we understand the story of how you went about trying to create a solution, even though many may exist, we understand that you may not just be there to sell it.